All right, everyone. Let's get into some of the breathing exercises. And I want to make it clear really quick before we get into them. I forgot to mention in the last video that when I tell people to rib breathe instead of belly breathe, most people think that I mean to just breathe into their chest and they like lift up their shoulders. That's not what I'm referring to at all. In fact, if somebody's chest breathing, then their ribs are most likely immobile and they're not moving correctly. We really want the rib cage to open up so that the shoulders don't have to move up and down. So that's kind of the opposite end of the extreme of just moving our belly, is to just move our chest and shoulders. Neither are ideal. So let's get started into the exercises. And without changing anything, now knowing what I've already told you, go ahead and lie down on the floor. I'm not going to lie on the floor with you for this exercise, but I do want to note that when you lie down on the floor, if your chest and your rib cage pop up and there is an arch underneath your spine, go ahead and place a pillow or a yoga half dome or some blankets underneath your head, possibly underneath your neck and shoulders, until your rib cage, the back of your rib cage, is touching the floor comfortably. I want you to be comfortable in this exercise. And then as you get situated, I want you to place one hand on your upper chest, one hand on your lower belly, and then just breathe how you normally breathe. I don't want you to change anything yet. So just breathe normally. Inhale and then exhale. Inhale and exhale. And now the next breath you take, notice if your chest hand does more moving or if your belly hand does more moving. So as you breathe, is it your belly hand or your chest hand? And take note. And on the next breath, I want you to breathe only into your belly. And then breathe only into your chest hand. Don't let your belly move at all. And then go back to your belly. And then back to your chest. And then your belly. And then your chest. Last time, breathe only into your belly. And that is the last belly breath that I want you to do during this video. We're done belly breathing. You can do that at night when you're sleeping. So now, lying on the floor, go ahead and place your hands around the bottom of your rib cage. And this is where people get a little confused with the belly and the ribs. These are still your ribs, and your diaphragm and your lungs are encased in them. So I want you to think about moving your hands apart from each other by moving your ribs as you breathe in. So as you breathe in, think of those ribs going side to side, going out towards your hands, and then back in. Inhale, go out, and back in. One more time, inhale, come out, and back in. And the next part of the breathing, if you place one hand on that lower rib cage, one on your chest, as you inhale, allow your chest hand to move and then your rib hand to move. And then the opposite as you exhale. And then chest hand, then rib hand. And the air goes in and out. So your lungs and your chest and rib cage will be moving in this up and down fashion. So inhale, feel the air go down and back up. And then the last dimension, placing your hands around your rib cage so that the thumb is on the back of your ribs. I want you to think about your ribs moving forward and backward. So we don't very often think of these ribs in the back of us as being ribs, but they are. So think about your ribs in the back, moving back into your thumbs and then back in. And then out and back in. Inhale and exhale. If that is a difficult motion for you to do the forward and backward, one of the tricks that I use is to take a yoga half dome or a small deflated ball, place it in your belly, and then lean over it. This blocks the belly from moving. And then as you breathe, think about the back ribs and your spine. Move the air towards that area of the body. And feel the rib cage expanding. So we're going to try to breathe in all three dimensions in just a minute now that you have a little bit of an understanding of what three-dimensional breathing means, or what rib breathing or diaphragmatic breathing. It's called all of those things. But really quick, if you're still having a hard time feeling your rib cage, there's a few tricks. One of them I just showed you, but the other one, if you have a yoga strap, you can take the yoga strap and wrap it around the bottom of your rib cage. And as you breathe, think about moving your rib cage to the strap, so the strap will feel like it gets tighter, but you're not going to pull it any tighter. We're not using it as a corset. You're going to use the expansion of your rib cage to get that strap to seem tighter. So go ahead and let's practice that. If you have a strap or a belt or even a piece of baling twine, go ahead and inhale. And exhale. And inhale. Can you feel the strap get tight? And exhale. One more time. Inhale. Into the ribs. And exhale. Now, go ahead and lie back down on the floor if you've sat up. And I just want you to take 3 really nice rib breaths. So clear your mind and inhale into your ribs. Exhale. Inhale. Feel your ribs moving and exhale. Last time. Go ahead and inhale into your rib cage. Feel it moving side to side, up and down, and front to back. And exhale. Now, this week, I invite you to practice breathing for 3 to 5 minutes each day and see if you can get the rib breathing to feel more natural to you as you go through your daily life. You don't need to focus on this a lot. It will come as you continue working and practicing. But just this week, focus on it for 3 to 5 minutes a day. And remember to keep breathing. Goodbye.